Hey, I'm Morgan Metzger. I'm a nursing student here at the University of South Alabama College of Nursing, and I'm going to be performing a medication administration checkoff today. So, here is my badge, and let me scan the room. Here's my tape I'm working at. Okay. All right, so the very first thing I'm going to do is plan for medication administration. So that is ensuring I have a distraction-free environment. I'm going to keep closed. I'm going to keep the door shut to the medication room. I'm going to not take any phone calls. I'm going to limit my conversation with colleagues to only essential information. And lastly, I'm going to follow the agency's no interruption zone. So after doing that, make sure I have no distractions. I'm going to verify my order from my patient care order form to our medication administration record, the MAR. So I'm going to be doing the 7 rights, which is the right drug, the right dose, the right time, the right route, the right patient, the right administration, and the right documentation. I don't know if I can think of that. All right, so right drug. We are going to be administrating, let's see, Novolin R regular insulin, U100. On the MAR it says Novolin R regular insulin, U100. So this is going to be given with 10 units. 10 units. This is a subcutaneous injection. A subcutaneous injection. And it's going to be given 30 minutes before meals. 30 minutes before meals. All right, so now I'm going to do the right patient, verify my patient. Patient is Mr. Jaguar Jones. Jaguar Jones, his date of birth is 8/25/1963. Date of birth is 8/25/1963. His medical record number is 417-6352. 417-6352. And I see he is allergic to penicillin, and penicillin is showing up on his medication administration record, the MAR. All right, so now that I have verified the 7 rights and compared it with the patient order form in the MAR, I'm going to be performing hand hygiene. And I'm going to be picking up my medication, which is going to be Novolin R regular insulin U100. And I'm going to first take the expiration date. It is not expired. So now I'm going to compare this with my 2 charts, the MAR and the patient's order form. So the orders for Novolin R regular insulin U100, Novolin R regular insulin. All right, so this is the correct one. This is what I picked up. All right, so since this is a subcutaneous injection, there is only, and it's for insulin, there's only one syringe we can use, which is going to be this 0.5 milliliter insulin safety syringe, this one. And I'm going to be opening it up, ensuring sterility, making sure I don't get anything not sterile. All right, so this is what it looks like. And so, let's see, the dose is 10 units. So I'm going to be getting 10 units of insulin into the syringe. So I'm going to take off the cap, put it on its side. I'm going to be picking up an alcohol pad. Oh my gosh. I'm going to be cleaning the top of my vial. So for these syringes, you have to draw back 10 units of air first before putting it into your vial. So I got 10 units of air just pulled back. I'm going to put it directly into my vial. I'm going to push that air back into my vial. Okay? So flip it over. And now I'm going to push or draw back 10 units of insulin. I'm putting it back in to ensure no air bubbles. So we're going to be looking at that first line. All right. Let me double check. 10 units. 10 units. All right. There we go. That is 10 units. If y'all can see. All right. So now I'm going to do the scoop method to get my cap back on. All right. So I'm going to put this to the side. So now I'm going to compare my vial and medication to the MAR. So this is the second check of accuracy. So I just did 10 units of Novolin R. This is 10 units, subcutaneous injection. 30 minutes before a meal. Mr. Jones eats at 5 o'clock and it is 4:30. So it is 30 minutes before his meal. And also, since this is insulin, I would have to get another nurse to come in and check my calculations. So checked it, we're good to go. All right, so now I'm going to create a label. I'm going to get a piece of tape, and I'm going to be writing down the name of the drug, Novolin R, regular insulin, the dose that I gave, which is going to be 10 units, and my patient's name, which is Jaguar Jones. All right, and I'm going to put that onto my insulin. My pen never shows up on this. I'm so sorry. So, this is what it looks like if y'all can see. All right, so now, I don't need this order form anymore. I'm going to be moving on to the patient's room. I'm going to be taking the MAR, my syringe with the medication I just put in, and also with the vial. So, we're going to be moving. I'm going to do a better position. All right, so we just got in my patient's room. This is my injection pad. This is my patient. All right, so I just walked in my patient's room. I'm going to perform hand hygiene. I'm going to verify my patient using 2 identifiers. First is with his name tag, Jaguar Jones. His medical record number is 417-6352. 417-6352. I see he's allergic to penicillin. Mr. Jones, are you allergic to anything else we need to know about? No? Okay. So, now I'm going to explain the procedure, what we're going to be giving to him. So, Mr. Jones, I'm going to be injecting your Novolin R, which is regular insulin. I'm going to be giving you 10 units subcutaneously into your abdomen, and going to be giving you it 30 minutes before your meal, which is going to be at 5 o'clock. So, with this insulin, this is going to be lowering your blood sugar. All right, any questions? All right, so I'm going to raise the bed up to a working height and lower the side rails. So, for my third and final check of accuracy, I'm going to be comparing my medication to the vial and my MAR. So, Novolin R, regular insulin. 10 units, we're at 10 units, this is expired. It's 4:30, he eats in 30 minutes, and this is subcutaneous. All right, so I'm gonna put this to the side, and I'm going to get an alcohol pad. So I'm going to be cleaning the injection site and putting on gloves. And goggles. All right, then I would clean the injection. All right, so for this injection, like I said, it's going to be in the abdomen, which is mostly ideal for insulin injections. If I'm going to recap or uncap this, I'm gonna put it in the sharps container. And I don't have to do anything before. I just need to see if I can pinch 2 inches of the skin. If I can insert the injection at 90-degree angle. If I can pinch it at 1 inch, I can do it at 45 degrees. But I can do it at 2 inches. So I'm going to be injecting it at a 90-degree angle, slowly pushing in my injection. All right, and then I'm gonna put it into the sharps container. And I do not have to aspirate for insulin injections. So now I'm going to dispose my gloves and goggles. And then I would perform hand hygiene. I would lower the bed and raise the side rail and make sure Mr. Jones is in a comfortable position. I would then document on my MAR how Mr. Jones handled the procedure and also notice if he had any allergic reactions. So, and that completes my medication administration checkup.